Hi, I'm Perry Atkinson, General Manager here at theDove. Hey, check out our other videos and check out our website at thedove.us. Always a delight to have Dr. Joel Klein with us today, and he's a physician there at Ventana Wellness, and we want to talk about kind of a hormone testosterone update. Now, I realize this gets a little interesting at times, but no matter where you turn, Dr. Klein, these ads are all over television and they're embarrassing.
Right.
They're just flat embarrassing.
Well, which ads are you talking about? Because they're the ones for the products, and then they're the ones now for the personal injury lawyers who are trying to drum
both,
up.
but
it's a class action lawsuit. Yeah, and that's what I wanted to address and actually use that as an example of things about medical research.
Okay.
So
it just seems like that the whole subject, testosterone levels for men, has come online, and then you got a gazillion products, and of course they're wrapping it around sensuality and selling a ton of these things. And are they any good? What's it all about?
Again, they're certainly, obviously anything is going to be used to promote more money. We're certainly seeing, I think, that people are arguing that we're treating things that just were always there but not a problem before. I think maybe there's some of that, but there's certainly one of the things that we're certainly seeing. Now, unfortunately, testosterone has been abused enough by enough people, bodybuilders and the like, that the FDA wound up, basically, actually the DEA classifying it as a federally controlled substance. Right. But what you're having, and whether there's a real andropause where men lose hormones, we're certainly seeing declining levels. I think there's a certain issue of functioning as we get older, that things that were just blamed on aging are actually declining hormone levels. And with men, we're not just talking about sexual functioning. I'm talking about energy, sleep, anxiety, all kinds of issues that I'm seeing that are related to lower testosterone. I think we're seeing an accelerated rate of lower testosterone in men. I'm seeing it in younger men. And it really, again, I think is coming down to the big three of diet, stress, and environmental toxins.
Okay. I got to put stress at the top of that.
Stress at the top, but not in these younger guys. Why am I seeing 20 guys in their 20s and 30s with a problem? Certainly stress in the older guys over time. We know that overactivation of the stress hormone axis, cortisol and all the rest, decreases hormone levels. Absolutely. Other things that are medications like chronic narcotics and chronic pain patients, and chronic antidepressant use so we want to classify that as an environmental toxin to some degree. Yes. That is causing lower testosterone. I think another issue are this is a tougher one to prove because they haven't looked at it in the right way, but the compounds called phthalates that are estrogenic hormone disruptors that we get from plastics. And the bisphenol A has gotten more press recently and all of those things. And I think we're actually, because of what women are doing to their unborn babies. And they actually did a study up at University of Rochester where they looked at the phthalate levels in the urine of these pregnant women through their pregnancy, and then looked at their male babies. And in the way that this is defined anatomically, the women with the highest phthalate levels in their urine had baby boys that had what was termed more feminized genitalia. Now, I don't think they even looked at these babies later on. What did that mean for their testicular function? This was an anatomic difference that we can get into the details about, wow, but it very well may be, yes, the prenatal toxin and the estrogenic hormone disruptors of pesticides are in there, but certainly the plastics are affecting males. So now we're seeing 20 guys in their 20s and 30s with functionally low testosterone levels. And this is the problem. It's not reaching the point where medicine will agree to define it as a disease. So they don't like it. Because this is a functional issue that clearly is affecting the quality of people's lives in many ways, and not just sexual functioning. Focus, concentration, like I say, mood, sleep, all of these can be related to testosterone.
All right. You have an interesting email here about the green drink you have every morning.
Well, that's something that that's a different topic we can talk about. Just basically, this is what we do in a lot of these, using a mega blender like a Vitamix or a Blendtec. People have the bullets. I don't know if you can make enough with this. It's making like 2 quarts and blending, not just juicing, a lot of raw vegetables. We do this, number one, and we're getting rid of, these is people with chronic inflammatory diseases, certainly autoimmune diseases, and people with chronic gastrointestinal problems where, based on my assessment, they have an overgrowth of yeast and bad bacteria in their gut. And we put in, you know, salad mixing cucumber and celery and all these different things. We keep out the root vegetables, only put like 1 carrot. We limit the fruit because we don't want to put too much sugar in there. And this is alkalinizing to the body, so it helps people with inflammation. I had one lady with rheumatoid arthritis who after 3 days on it felt a difference. But this is something we counsel people in the office for.
Right.
That's a different issue.
Oh, different issue. But if you want to address him on that, make an appointment.
Yeah, we actually have a nutritional counselor also that will work with people on doing that to make it palatable for themselves.
What are the signs of low testosterone?
Well, all the things that I mentioned. Obviously, not only the sexual functioning issue and libido, but again, motivation, initiative. Now, that can just be blown off as depression. And I've seen, you know, both ways. Anxiety, low initiative, poor sleep. Yes, those can be signs of depression. But I've seen the path go both ways. I've seen guys that you give them testosterone and their whole life changes. Yes, and I've seen guys, I gave them testosterone, even though it was low, it didn't make the difference, and lo and behold, we wound up using an antidepressant. Darn if that didn't help them. So it's not as easy to define. The best way that I know is if somebody does have a functionally low testosterone level, treat them. See what gets better, and we treat them to the point, and this is one of the things that will go along with the study, where we make sure that their blood level is up in the upper half, certainly, of the normal range, where we know they should be getting a response. And if they don't, then it's like, wow, then it looks like maybe something else is going on.
All right, and all this is done through blood tests.
Yes, we do it all through blood tests. I mean, alternative practitioners who can't order blood tests may do saliva, but there's very good parameters, and urine tests, very good parameters for using blood tests that we use.
And so all right, so you're low in testosterone. How do you bring that up? I mean,
well, that's the issue. So a lot of the times it can be done with topical preparations. These are what are being advertised on that the drug companies have come up with. They've come up with an alcohol-based underarm thing, or these topical creams and foams and the like.
Do they work?
They do for a lot of people, but for a lot of people they don't. Is what I find is that they don't get the level up high enough. And we actually have to go to injections, which patients can self-administer. We show them how to do it. It's fairly simple. But this is one of the issues. And the thing is, they're charging so much for the commercial preparations. I mean, yeah, $400 to $500 retail a month, that the insurance companies, when they'll cover it, you have to have a certain below a certain level of blood on your blood level for them to cover it. But even if the insurance companies will cover it, they're charging a $45 to $80 copay per prescription because the drug companies are charging so much for it. So a lot of times we prefer to do this with a compounding pharmacy. We can adjust the dose exactly for that patient. And for a lot of the compounding pharmacies, quite frankly, I hate to say this, but I will. I would prefer to give the economic benefits to local businesses rather than to the big chains that are headquartered in wherever, and to the insurance companies, if I can guarantee that my patient is getting a good product. That's the thing. I don't want to sacrifice the quality, but we have a number of pharmacies in the area that do provide good quality that we like to use for that.
Joel, this is so prevalent. We see it everywhere. Everybody's talking about it now, so it's no longer a closet issue. It's very much in the forefront.
And just like anything else, whenever there's an economic gain to be found, it will be overblown. So not every man who has a problem has a testosterone problem. And I've had, quite frankly, patients who the problem was really in the marriage and their relationship, but the wife insisted that they get their testosterone checked. And as I explore it, that's not their issue.
Do you think this will ever head to over-the-counter?
No. No, well, not with real testosterone.
Okay.
Yeah, that's way too potent. I'd say it's now it's a controlled substance.
Okay.
It's like, going over the counter morphine.
Can you OD it?
You could. You really have to if you take too much, and the signs are what we know from the bodybuilders and the people who did. It's the, acne and road rage and,
yeah.
And those kind of steroid overdose. Yeah, but it's not something you do one time. It has to be chronic doses over time that you'll push your blood levels too high.
We've got about a minute left. How often do you check patients for their levels?
Once we have them stable, every 6 months. In the beginning, I'll do it every 6 to 8 weeks till I get them where I want them. And then they also need a blood count and a liver panel, because occasionally we find people whose blood gets too thick or develop liver enzymes, but not very often.
Well, great. Thanks, buddy.
Okay.
And again, he's back quite often. We'll get into green drinking.
Okay. Well, I want to get into that one study, so we have to. That's where all the lawsuits are coming from. That is actually quite questionable.
We'll take a look at that. All right,
okay.
VentanaWellness.com is the website. VentanaWellness.com. Dr. Joel Klein, he's a physician there, and you can call and make an appointment to see him there. VentanaWellness.com. Thanks for coming in, buddy.
Okay. Thanks.
All right, we'll see you next time on Focus Today.